My name is Abigail. I'm the host of the Cradle to Crayon Show on Sunny 88.7 FM. Starting this February, join me on Sunny TV as I bring to you the Cradle to Crayon Show every Friday morning from 9:30 to 10 a.m. I host gynecologists, pediatricians, pediatric nurses, clinical psychologists, midwives, speech therapists, and so many as we discuss on issues pertaining to women and children, even the family inclusive. Don't forget, it's a Cradle to Crayon Show right here on Sunny TV every Friday morning.
It's a Cradle to Crayon Show right here on Sunny 88.7 FM. We thank God Almighty for the gift of life. We say thank you to our sponsors, Back Specialist Hospital and Fertility Center, and also to Secure Sanitary Pad. We are live on Sunny TV. Check out our Facebook page, Cradle to Crayon Facebook, and also Sunny FM Facebook page. We are live there. Join the discussion. It's very interactive, and let's learn one or two things. Now, this morning I have here the medical director, also pediatrician in charge of Rohi Children's Clinic. I want to talk about precocious or early puberty. This is more of a technical word. We want to find out what this whole word means, why it should actually be a cause of concern to some parents who are experiencing seeing this in their girls or in their boys, complications that are likely to arise if it's not attended to, and then some treatment options available. But before then, we'll take a break and message from our sponsor, Rohi Children's Clinic, The Time with Dr. Apana, as she talks about allergy. We'll be back.
When I was a kid, we had this guy in our class who was always sneezing or blowing his nose. And nobody wanted to sit with him in class because we're all afraid we'll catch his cold. Now I know better. Kids who do that may have allergies, you know. Sadly, such kids suffer quietly because no one pays any attention. Some people even label them as annoying. Most allergies are mild, but any kid with allergies can have a severe life-threatening reaction if the circumstances are right for that. But help is available. So talk to your child's doctor and let's make life easier for our kids with allergies.
Show right here, brought to you by Back Specialist Hospital and Fertility Center. Now visit the center for all your fertility, maternal and general health concerns. Their services include IVF, IU, and other fertility services. They do child health and pediatrics, women's health and gynae, obstetrics and maternity, internal medicine, general OPD care, inpatient care, surgical service, that's both general surgery and also plastic surgery. They do theater service and then laboratory and ultrasound scan service. Visit them right here in Accra, they are in Taifa, or call them on 0558 862 292 or 0592 196 003. Bath Specialist Hospital and Fertility Center, integrity and excellence in healthcare. Our WhatsApp line is 0540 130 684. We are live on Facebook. Check out our Facebook page. You can join the discussion also on Sunny TV. We are there, and also check out Cradle to Crayon YouTube page. We are there. You can join the discussion. Drop your questions, comments, whatever it is, and my doctor here will answer. She's in the person of Dr. Abena Tete, medical director in charge of Rohi Children's Clinic, and also the pediatrician. Dr. Tete, good morning.
Good morning.
It's good to have you back here.
Good to be here.
Yes. So, precocious puberty. Before we talk about this word, let's first take the puberty. When do we say puberty has happened?
Okay, so puberty, it's a normal thing in life. Everybody goes through it, and it's just a time of very significant physical as well as hormonal and psychological changes that take place in a child. I mean, during that period, the child's body transitions from that of a child to that of an adult that's mature enough to reproduce.
Okay.
So puberty is just that transition from childhood into adulthood so that you can have babies.
Okay.
That's what it's all about.
Basically, that's what.
Yeah.
So when the precocious comes in, what are we dealing with then?
So precocious just means early.
Okay.
It means it's not yet time. So maybe in Chi they'll say in Penism.
Okay. So it means the right things are happening at the wrong time.
Exactly.
Okay. How early are we looking at?
So in girls, normal puberty is usually between 8 and 13 years, and it's between 9 to 14 years in boys. So if you have a girl who's not yet 8 showing signs of puberty, or a boy who's less than 9 years old, then that's precocious.
Okay.
It's too early.
Okay.
Yeah. And sometimes it can be as early as in babies.
Babies.
Yes.
As in babies.
Yes, it's documented that some people have started puberty before age 1.
Wow. Would you consider it as a disorder?
It is.
It's
Obviously,
a disorder.
It's not normal. Yeah.
Okay. You had mentioned signs. What are we to look out for? You're saying a baby.
Yeah.
What do you expect to see in a baby to come to conclude on that?
The same puberty things that you see in your 10, 12 years old.
Okay.
So they have the hair in their underarm and their pubic areas. You have breast development in the girls. The boys have their testicles enlarging. And then you have adult body odor and menstruation. And all that happens in people with precocious puberty.
Okay. I'm sure just as you're having early, there should be some delayed. It's delayed. Sometimes it's delayed.
Yes, there's delayed puberty. I
Okay.
think that's even more common.
It's more common.
Yeah.
Okay. But with the precocious, not as common as...
So precocious, yes, it's not as common as the delayed, but it does happen. We see children with precocious puberty quite a bit.
Okay.
Yeah.
What's known to cause this?
So there are different things. Once in a while, it runs through families. So there are few families that have puberty early. But aside from that...
So once it's happening to either the mother or father, the child...
Yes, you would find that the grandmother had it, the siblings are having it. So yes, you have it that way. So, but then there are other things, lots of other things actually. So there are two main types. There's the one that starts in the brain. So things that go wrong with the brain. For instance, a brain tumor or an injury to the brain. So somebody is involved in an accident or something, trauma, and then things start producing the wrong things at the wrong time. Some infections in the brain can do that. And then there's the type that we call peripheral. So that starts on the outside. So that is the brain sends out the first signal for the sex hormones to be produced by the respective organs. So aside from issues with the brain, if the organs themselves, the ovaries, the testes, there's one called the pituitary somewhere, all those organs that are involved in production of sex hormones, if there's something wrong with any of them, it can trigger production of the hormones at the wrong time, and then you get precocious puberty. And then the third thing is things that we introduce from the outside, so from the environment. Anabolic steroids.
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 As early as before age 8?
Yes, if for whatever reason somebody goes to give anabolic steroids to a child.
To a child?
I don't know why
would
they
somebody
would do
want?
that.
Is it for medication or?
I don't know. Athletes take them.
Okay.
I'm not too sure why but yes, I mean children, the latter years of childhood, for whatever reason, if they took that, they would get it.
Okay.
And then, but more commonly, and what we can relate to better is plastics.
Plastics.
Yes, a lot of
the plastics, the butter bottle, the bottle. Okay.
Yes, a lot of plastics contain chemicals that we call them xenohormones. So they are like the chemical structure of these chemicals in the bottle, in the plastics, is the same as the structure of the hormones in the body. It's very similar. So if they get into the body, they go and attach to the same receptors that the hormones would recept to, and they trigger them to perform the same functions. So plastics are very, very important. We need to watch them.
Okay, so I'm not really getting it. That's in there. Are disposable bottles when you're down drinking your water, maybe something is part of it is melted.
Yes, so
you inhale it.
Exactly. You drink it.
You drink,
some of the chemicals, they actually leach into food and drinks, which is why you need to be careful. Microwavable bowls, if you look at them, they usually would have it written that they
microwave safe.
Yes. What it means is that they are food grade plastics. So those ones are safe. They don't contain these poisonous chemicals, if you like, that look like hormones. Okay, so your water bottles and stuff should be made of food grade plastic. But you find that a lot of the things that we use, all sorts of plastics, we put our food in polythene bags, we put hot stuff in cling wrap, and and
you've been told not to put food in the white rubber, the banku rubber,
because
the black, but they are producing it for us, so
they are producing it for other issues, and we are using it but it's not right. And in other places the laws are very stringent, they enforce them. It's not allowed.
Okay.
So we have to take charge of our own health.
Get other
to
options
get
for
other
it.
options, yes.
Okay.
I
Okay.
mean, your normal plastic bowl that you use in the kitchen is okay for eating if it is made of the correct plastic. But if you go and put your hot food in something that contains some of these chemicals,
Okay.
then the heat causes it to leach into your
Okay.
food. So you are eating it bit by bit.
Okay.
And with the children, the effect is always more pronounced than in adults. Yeah. So,
Wow. You had mentioned that it sometimes runs in families.
yeah.
That's a risk. Yeah, at a risk if if a family member has had it before puberty. In our recent times, did you consider our diets as parts? Because you realize that young girls and boys coming up of late, you see them and you think some thinking that they are same age as you or even much older. Is it the food they are eating or there's something more they are taking that's making them do that?
Increasingly, there's a trend towards earlier puberty, generally.
Okay.
I mean, and there are a lot of factors. But yes, nutrition is better now than it was some time ago. And if you are malnourished, you actually tend to have delayed puberty. So if you are eating the right things, and I think that now, maybe many more of us are feeding our children better than probably in the past. So it may not necessarily be that those ones are reaching precocious puberty. It's just that they are doing it at the normal time. And maybe in the past generations were a bit delayed, but then it was normal. So it's not really precocious. The precocious, so that's why now the definition is 8 years as the cutoff point.
8 years.
8 for girls and 9 for boys.
Okay.
Because even if they are eating very well, you're not expecting your 5-year-old to be menstruating. Yeah. So that is definitely not right. Yeah.
Okay. I've also heard of second puberty. I don't know if it's something if you've come across.
Well, not really.
Not really.
No.
Okay. I want us to look at how this is diagnosed. You had mentioned some of the symptoms.
Right.
I don't know if you want us to go over with the boys and the girls. Are they enough to just walk in and say this is it, or for a parent to bring a child in? How do you diagnose it to conclude that this is a disorder you are dealing with?
Right. So definitely, if you see your child showing any of these signs, just go off to the hospital, show the child to a doctor. How to diagnose it? We always will start a diagnosis from a history. So we would ask what is going on, just to be able to figure out whether it's something to worry about or not. And then you would do a clinical examination. So you would look at the child's body, you would look for all these signs that we are talking about. And then you would look at, of course, sometimes you find that you might have a child who's chubby and has some breast enlargement. It may not.
So with the boys.
Well, yes. It may not necessarily be breast tissue per se.
Okay.
It's probably fat. So with a trained eye and trained hands, we'll be able to know whether it is breast glandular tissue or it's fat. So you would do an examination, and then there are tests. We would find levels of sex hormones in the blood. Sometimes you would do x-rays looking at the bones. There are signs in there that would show you whether the age of the child's body corresponds with the child's actual age or not.
There's something to determine all
so
that.
there are tests that we do, and then we put them all together and interpret them. So yes, it's quite an extensive way of diagnosing to be sure that that's what's going on.
That's what you are dealing with. Okay. Well, it's just 12 minutes to talk with. I have here Dr. Abunatete, Medical Director, also Pediatrician in charge of Rohi Children's Clinic. We're discussing precocious puberty. Our phone lines have been open. Number to call is 0540-130-684. 0540-130-684. It's the same WhatsApp number. Send us a WhatsApp message. My doctor here will answer you. We say thank you to our sponsor, Back Specialist Hospital and Fertility Center. Dr. Abna, I want to find out. I know some parents, when some of these signs begin to happen, do you think this thing should be much of a bother to them? Should they be concerned that at age 8, this is what is happening? Even before age 8, this is what is happening to my daughter or to my son. Should that be a cause of worry?
It should, because it's not normal.
It's not normal.
And it gives issues, you have complications, challenges later in life. Maybe I'd go on to talk about some of those, so you see how
the complications.
serious it is.
Okay,
Yes.
that's if it's not attended
If
to.
it's not attended to and it continues. So what happens is that these children grow very fast. But in a child's body, the bones are not all together. There are spaces in there. We call them epiphyseal plates. So those spaces are where growth takes place. But if the child grows too fast, it means that then those places will close up too early. So even though early on they look bigger than their peers, eventually their growth stops earlier than it should, and then they end up looking shorter than they should be.
Shorter when they become adults.
Yes. So as adults, they have short stature. They are really short.
Is it so with all adults who are short?
No. Some people, I mean, not all of us at all.
Okay,
But
okay.
with this one, it's abnormal because they wouldn't have been that short if they hadn't produced those hormones. You know,
Okay.
because the hormones accelerate their growth and then at a point stops the
It
growth.
stops.
Yes.
Okay.
So short stature is one. They have a lot of psychological issues because they are different.
From their peers.
Exactly. Imagine you're 4 years old and you're menstruating. You're confused. So they have a lot of psychological issues, and for some of them, they end up getting into illicit drug abuse and all that, just as an outlet for their depression. And then in later years, in adulthood, precocious puberty puts people at risk of certain diseases, heart diseases, diabetes. So, you know, it's a risk factor
It's a risk
for
factor.
disease later in life. Even certain cancers, like breast cancer, because the earlier you start producing some of these hormones and they stimulate those parts of the body, the breast, the ovaries, the more they are stimulated over time, and then some of these cells become cancerous.
Okay.
So it's
okay.
quite a serious thing.
Okay. Can it affect their lifespan?
Yes, I mean, obviously, if you develop a cancer at age 30, if you are not cured, then you might succumb. So it can,
Okay.
with all these later diseases that you will get.
Diseases.
Yeah.
Okay. Okay. Now I have the question here. Says, good morning. My 3-year-old daughter has bad odor in her armpit sometimes. Could this be early puberty? And how do you reach the doctor if you want to visit her outfit? Okay. So we'll talk about the whether the bad odor is a cause of this.
So bad odor is relative, and like I said, you need to examine the child in full, because sometimes when it's a one-off something, it may not necessarily be a challenge, it may not be a problem. So it may be that the child sweats a lot, and some children are quite sweaty and may have that smell. It's just that there's a distinct adult smell that you get at puberty,
like full-grown adult smell that you
Yes, so if it is that kind of smell, then it's worth looking at.
Okay.
Yeah.
Okay. Because now these kids come back from school, they are sweating from classroom activity
Exactly.
and all that. So that one there's no cause for concern.
I mean, every kid after jumping around would have that sweaty smell, but what we are talking about is that adult smell, and I think we all know what that one
is.
Yes.
Okay.
So it's the adult smell that you need to take care of. That's a problem.
Okay. Now, when it comes to management and even treatment, what is the aim of it? You know, when you are dealing with something like malaria, you are treating malaria, you take your course, you are done. If it's an infection, you take in antibiotics and then you are done. For this one, what is the aim of when you treatment comes in or even management comes in? What is it to do? Because it's a right thing which is happening.
Yeah.
What's the treatment aim to do?
The aim of the treatment is to, if you like, delay the puberty until the right time.
You delay it.
Yes.
Okay.
So you want to stop what is going on now because it's not yet time, so that the child can grow normally as a normal child should.
Okay.
And then when the time is right, when they are the right age, then the process can go on as it should.
Okay.
Yeah. So and then of course I mentioned that certain diseases could start precocious puberty. So then the other aim is to treat those diseases.
To treat them.
Yeah.
Like I had mentioned, the brain tumor,
Yes, so
brain injury.
definitely. I mean, if you have a brain tumor, then we need to do something about it, because it won't just give you puberty. It might cause other things that are deadly. So you want to get rid of those conditions as well.
Okay. So it means for every child that comes in, they diagnose and every child will need a treatment for this.
Depending on the cause.
Okay.
Depending on the cause, because if it's the underlying cause is something that you can get rid of, and then the process will stop, then you want to do that. So the treatment is not one size fits all. It depends on what is causing it in that particular child's
Let's look at the treatment available. Is it in the natural process? You take some herbs or something?
So like I said, it depends on the cause. So it won't be easy to talk about treatment as in malaria, you take this medicine. No. It depends on what is causing it. You look at, is it a tumor? Is it a particular organ that has gone bananas? Is it an organ that has developed a cancer and the cancer cells are producing? So you look for the cause before you treat.
Okay. Now this question is asking, please, will doctor recommend the use of puberty blockers? What are puberty blockers in the first place?
I'm not too sure what the person means by puberty blockers, but there are medications also, depending again on the cause. I'm being very careful about this, depending on the cause, that would stop whichever, because there's a lot of sex hormones involved in this. In fact, a lot of hormones come together to produce this. So whichever one is the cause is what you want to treat. So you don't just go and pick some medication and say they are puberty blockers and give it. You don't know what's happening in the child's body. So I wouldn't recommend that. I would say that this is a serious situation. There are people who actually specialize in taking care of it. So let's have somebody look at the child and then treat properly.
I wanted to actually find out, so which area of specialty handles?
So, I mean, you would have, every pediatrician is trained to know how to diagnose and how to do, but there are also people called pediatric endocrinologists. That's a subspecialty. We don't have too many of them in Ghana. Yeah, we don't. But that's a subspecialty. And so if it's something that is out of the reach of the pediatrician, then they would always get in touch with a pediatric endocrinologist and then refer the child appropriately, or depending on where they are, manage together with sometimes you need to do it together, because there are other fields that need to be, you may need a neurosurgeon, for instance. If there's a surgical cause, you may need other kinds of surgeons. So you have a coordinated thing depending on what is causing. Sometimes you have a few different specialties involved. It's not just one doctor sometimes. If it's a simple thing, then probably one person.
How long is the treatment usually?
Again, depends on
it
the
would
cause.
depend on the cause. Yes.
If it's something you can get rid of right now, why not? But sometimes you would have to treat. Sometimes you have taken care of what triggered it, but you may also need to continue with certain medications for some time. So it's not the kind of thing where one size fits all. No, it's a very individualized sort of management here.
I'm asking so because you said the treatment is to slow the process. So let's say maybe take it for some time, and then you get to the year that you're supposed to, nature needs to take its course, then you stop.
Yes.
Is that how it works?
Yes, that's in simple terms, that is how it works. You want to get to the point where nature, but sometimes you do not stop the you can't. So it depends on what we are dealing with, because there are certain conditions that you may have to treat for life. There are certain conditions that, and then the medications change, the doses change as the child grows. So there's a lot of things that come into play here. A lot of things.
Okay. So I have this question. It's saying, hi Abby, with the issue regarding allergies, does the cells which causes the condition affect individuals in picking out a life partner in marriage? May the peace of the Lord be unto you. This from Mr. Robert Ajete Ajay Senior Abukobi. So asking about, was it allergy we played, the audio you did? Okay, so with the issue regarding allergies, does the cells which causes the condition affect individuals in picking out a life partner in marriage?
That would be quite a broad statement to make, because there are different kinds of allergies and different things that trigger allergies for people. So to say that it would affect your choice of a life partner or not it's kind of very broad.
Okay,
Yeah,
okay.
because it's not like something like sickle cell where it's a little more straightforward. You
Okay.
know, yeah, with allergies. So generally no, but and again, I'm not too sure because people are allergic to different things. You may even have siblings who are allergic to different things. So
Okay.
then it's not. I don't think it's something that you need to look into too much
Okay.
with a life partner.
Okay.
Having said that, there may sometimes be some disorders. What you might call an allergy may not necessarily
Be an allergy.
exactly.
Okay.
So for those ones, you need to be careful.
Okay. Okay. This other question is saying, my 10-year-old girl has a lot of acne on her face. Is it normal, please?
Generally, 10-year-olds they are heading towards puberty, and once they get there, people develop at different rates. So for her, it may be normal, but if it's worrying, I think that you should get somebody to have a look at it because, like I said, that may just be the only thing, which then might not be a problem. But if there are other signs that are worrying, then it should be dealt with. But at 10, she's hit the normal age of puberty.
Okay.
Yeah.
Okay.
10.
So it's normal.
Yeah.
Okay.
And some people might get more acne than others. So
Or maybe the pimples as well.
exactly.
Yeah.
Exactly.
Yeah.
You may have some people who are 14, 16, they don't have any at all.
Yeah.
You may have somebody who's 11 and
Who
is
has
already
it.
breaking out. Yeah.
Okay. Okay. Now this other question is saying, does it in any way affect the child's fertility in the future?
So it does.
It does.
But not the way you are thinking. Because the truth is that once you have hit puberty and you got all the processes going on as they should, you should be able to have children. So in that respect, yes. It means that the child is capable of having a baby. And indeed, the youngest documented mother was 5 years old. She had
5 years?
precocious puberty, yes.
And she had a baby.
And she had a baby.
She was raped, right?
And that is what is thought.
Okay.
Yeah. And but she looked like she had an adult body and she had a baby because they had to take it out by cesarean section because her canal was a bit too small.
5 years?
Yes, 5 years. So the child grew up thinking that was his sister.
Yeah, definitely because of the age difference.
Yeah.
Just, yeah.
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 So that is the effect it can have.
Effect it
The
can
child can, if it's a boy, he can impregnate someone.
Okay.
Yeah.
Okay. So it means one of these, it make them behave in a behaviors that are not appropriate to their age.
Yes.
Yeah.
Yes.
Yeah.
They have all the adult impulses and the libido and all that, which they shouldn't be having at that age. So their behavior is, and it's all part of the reason why they have these psychological issues, because they know and feel more than their peers.
Their peers.
Yes.
Can this actually be prevented? Can it be avoided?
Some can. I mean, having talked about the causes, obviously there are some of the causes you can't do anything about. But there are some that you can do something about. So if you can, why not? I mean, we one of the risk factors is obesity. Obesity actually predisposes people to precocious puberty. So, and I see a lot of obese children working
As for that
around these
area,
days.
we have a lot of them. Yeah.
So
I think it also comes down to the food we are giving them.
and the quantities.
The quantities.
And the type.
Okay.
We are
Okay.
feeding them a lot of fatty, ultra-processed foods.
Okay.
So that would lead to obesity, and we are encouraging them to sit in one place all the
Sedentary
time.
lifestyle.
So that puts them at risk of precocious puberty. So if you are preventing obesity or you're encouraging your child to be active and eating right, you are preventing precocious puberty indirectly.
Okay.
If you are watching the kind of containers you are putting your hot food in, you are preventing.
Okay.
So
But some would think, there's a long shot. There's something I've done over, so it's not really going to have any effect or something.
Yeah, it accumulates.
Okay.
See, those chemicals accumulate in the fatty tissues in the body. So over time, you will get enough. Plus, don't
Eventually.
forget, your own body is producing its own small quantities of hormones. So you add a little on, and it becomes too much. Eventually, you would get the effects if you are so predisposed. Yeah.
Okay. our time is up. We have just a minute to go. So the one who has a question earlier was asking if you can read a doctor. If you can, how do we read a doctor if you want to visit her outfits? So is there a number you want to give us?
I think you would want to play it out on the.
Okay.
Yeah.
So number for Rohi Children's Clinic. We'll give the number out when we are done. I'll WhatsApp the number to you. Yes. Any last words, final words on what you said so far?
Yes. So like I said, you in life you prevent what you can prevent. There are some things you don't have any control over, but if you can do something about it, do it before it happens. So let's look at what we are feeding our children. Let's look at their lifestyles, and then if you see anything abnormal in your child, don't wait. I always say that it's better to go to the hospital and be told there's nothing wrong than to stay till it's too late. So if you see your child showing signs of puberty, and every adult has been through it, then kindly take the child to the hospital. Let a doctor have a look at the child.
Okay. Yeah. Thank you so much. Thank you. And then thank you to all those who listen, those who watch, to our sponsor, Bank Specialist Hospital and Fertility Center. Don't forget, same time tomorrow will be a repeat broadcast on Sunny TV. Have a good working day. I say thank you to the guys there, to Eugene, to Nee, to Bless, and to Ezekiel. Enjoy your weekend. Bye-bye.
My name is Abigail. I'm the host of the Cradle to Crayon Show on Sunny 88.7 FM. Starting this February, join me on Sunny TV as I bring to you the Cradle to Crayon Show every Friday morning from 9:30 to 10 a.m. I host gynecologists, pediatricians, pediatric nurses, clinical psychologists, midwives, speech therapists, and so many as we discuss on issues pertaining to women and children, even the family inclusive. Don't forget, it's a Cradle to Crayon Show right here on Sunny TV every Friday morning from 9:30 to 10, and a repeat broadcast on Saturdays from 9:30 to 10. We'll talk on issues that you want to hear about your children and issues on women. Stay tuned.